Hello, good afternoon. Welcome to a rather special My Jericho today. Today we've got Dr. Helen Salisbury from the Observatory Medical Practice, which is slap bang in the centre of Jericho. I only ever hear good things about that practice, and only ever hear good things about Helen and the wonderful work they do for the community. Helen, first of all, tell us, who are you and what do you do?
Hi, I'm a GP. And I've been working at Jericho Health Centre since 2002. We moved across the road into our lovely new building a few years ago, but it's still the same team. And I look after the people of Jericho and a little bit further afield. I do a bit of teaching as well for the medical school, and I write a few things and tend to be a bit more outspoken than is necessarily good for me.
Indeed, you stood for Parliament as an NHS candidate, didn't you, in 2015?
I did, yes, I did in 2015 and again in 16. Yeah, not very successful.
How many votes did you get?
Do you know, I can't even remember. I think it was a bit over 1,000 the first time, but it really wasn't a lot.
So you're obviously a firm believer in the NHS.
Absolutely. I think it is one of the best things about the UK is our decision all those years ago that people's health and their access to healthcare shouldn't depend on how rich they are.
Now let's talk about COVID. Now, in terms of testing, where can I get tested in Jericho?
I don't know that you can get tested in Jericho. I believe there's a testing centre on Osney Island, which is our nearest one. There was an interesting decision at the beginning of this pandemic to set up testing for COVID completely separately from everything else the NHS does, and really to outsource it. Lots of tests are required by post, because you can fill something in online and something could be posted to you. You may also be directed to a mass testing site. I think it has made things a little bit difficult for people who are not happy using computers or not comfortable using them every day. So I think access to testing is better than it was, but it's still not brilliant.
So what are the symptoms I should look for before asking for a test?
Really interesting question. The classic symptoms are high fever, feeling breathless, loss of taste and smell. We are gradually finding that more and more people have a range of other symptoms. Sometimes it may seem quite indistinguishable from a normal sort of flu-y illness. Some people are presenting with skin rashes. Some people are coming with diarrhea. So at the moment, it gets more and more difficult for people to say, this definitely isn't COVID. And it gets quite difficult for us in the medical profession as well to know who we should send to the kind of COVID-specific clinics to be evaluated and swabbed, and who we should see ourselves in general practice.
So if in doubt, ring, is it 111 and describe your symptoms and try and arrange an appointment? Is that the number?
Yes, if in doubt, ring 111, or you can ring your GP and they'll talk to you as well about it. But it is quite a difficult to make, because as the pandemic has worn on, we've learned that it's really difficult to say that anything isn't COVID. I mean, obviously, there's some things that aren't COVID, but new symptoms, particularly new symptoms that seem to be of an infectious nature, may be COVID.
Now, less than 100 yards, or maybe 100 feet away from you, is the testing centre for the university. Is that much used?
It certainly was last term when there were a lot of students in Oxford. I don't know how well it's being used now. There are some students still here. There are students who don't have anywhere else to be, who can't work at home. There are graduate students who actually live here. So a lot of the university still is using that centre, but I haven't seen figures recently to how fully it's used and how much at capacity it is.
Would you like to see that opened up to the community?
That might be quite a good a good thing to do. I haven't heard that suggested, and I don't know what's happening with it at the moment, but it would be useful for people to have somewhere they could go to within walking distance.
I suggested it and I got the runaround from the university.
Oh, really? Okay. And
but however,
what was their response?
Their response was, this is a contract with the NHS, you have to contact them, contact the chief executive of the NHS.
Ah, right. Okay.
But I'm not easily put off, you might have worked out.
Absolutely.
Now let's move on to testing. How many tests have you, vaccinations, how many vaccinations have you as a practice done?
Okay, so we're working with our primary care network. So there's a group of GP practices, and ours is my practice, which is Observatory, and the Lever practice, which is the other one that's in the same building as us, and two of the Beaumont Street practices and King Edward Street. So between us, we've given about 3,500 vaccines so far.
That's in under a month, is it? Since January the 8th. So
our first vaccines were given on December the 19th. We could give huge amounts more than that. We've got loads of capacity, but we're just not getting the vaccine at the moment. So the limiting factor is vaccine supply, particularly with the new vaccine we're using, which is the Oxford AstraZeneca vaccine. We can give it really quickly. There's no requirement for people to sit and wait for a quarter of an hour. We can run it as a walk-through clinic, which is what we normally do with our flu vaccination clinic. So we can do loads and loads and loads in a really short space of time. So yesterday we had a COVID vaccine clinic. It was, I think we had 400 doses of the vaccine to use, and all done in 3 hours. Really not a problem. So we would be right down through all of our vulnerable people by now if we had the supply.
Talk us through the supply problems, if you could, please.
Well, we don't order it. We just take what we're given. Okay, so there's a website, and each week we look on and see, have we been allocated any vaccine, and hurrah if we have. I understand that there is a supply problem nationally. I don't think we have all the details of exactly why that is, and it's fair that it should be going across. I mean, it should be spread across all areas equally. I mean, it would be silly for us to be, or unfair if we were vaccinating our age 70s when other areas still had people over 80 who hadn't yet had the vaccine. I guess one of my concerns is that some of this vaccine is going to these mass vaccination centres, and it's very unclear how which people are being invited to those or how they're selected.
There's a question about that from a member of the audience, Elaine Sugden, who you may know, who's an oncologist, who says about the CASAM Centre, what's your view on that? Because she's been relicensed by the General Medical Council. Should she go and work there? Is it going to cut across your work?
I honestly don't see the reason for having a CASAM Centre. There are GPs, GP surgeries, primary care networks who are all set up, ready and waiting. We'd like to call our own patients in and be able to vaccinate them. And for our patients, it probably makes more sense to come locally to their own GP surgery. So why the expense of hiring the CASAM and getting lots of other people in there to do it? I really don't understand. It makes no sense to me. She'd love to help, and I'm sure she'd be doing great service if she did, but it doesn't make sense in terms of the overall limiting factor on the vaccine program at the moment is not places or vaccinators, it's vaccine.
So is it optics and PR, the places like the CASAM Centre are being opened up?
You might think that. I couldn't possibly comment.
very, very political. So, I mean, I've seen taxis depositing lots of old people outside of your surgery. I mean, 1 weekend I think you did 1,000 vaccination. Was that a correct figure?
I think we did about 900 in one day. Yes, on the on Saturday. Yeah. In fact, actually, no. The second weekend we probably did a whole 1,000 in the weekend, or a bit more. Yeah. Once you're organised, you can do it. And it's actually it's a lovely thing to be involved in. It's quite tiring running those long days, but everyone is so pleased to be there and pleased to be doing it. Both the patients who are coming in and the staff who are there doing it. It genuinely feels like a rare moment of positivity in this pandemic.
How do people get the vaccine? Do they have to? What do they have to do? Do they have to? So just get rid of this. Do they have to wait to hear from you?
Yes. So we're contacting everybody. So far, we have vaccinated, I think, 88% of the over 80s in our practice. So the few that we've not vaccinated yet, some of them are housebound, and we are now doing our visits to the housebound. That's a little bit slower to get going, but we're working through those who really can't get out of the house. We have a few people who've decided they don't want it. Not very many. I think under 10, but there's a few. And there are
under 10%. Under 10%. Is that under 10%?
No, under 10
or
people.
Under 10?
Fewer than 10 people.
Right. And what percentage is that of your over 80s?
Oh, I think it's maybe about 3%.
Mm-hmm, mm-hmm.
So not very many at all.
What sort of reasons do they give, and how do you convince them otherwise?
I think some of them are just afraid, and that's fairly normal. And I think I don't want to put pressure on anyone to have the vaccine. I hope that many of them will, when their friends and their family have had the vaccine and are fine and are doing well from it, will say, actually, do you know what, I will have it now. I think people are quite worried about new things and what might look like untested things. It's not untested. We know that it's had very rigorous testing. But not surprised some people are cautious.
Is there anything to be afraid of? What would your message be to the anti-vaxxers particularly?
We've now given, over the country, many millions of doses of vaccine. And there were, in the very first week, there were 2 healthcare workers who had previously had very serious allergic reactions who had allergic reactions to these. There weren't, they recovered very quickly. It was nothing major, but that made people a little bit cautious. Since then, we've heard of no major reactions. It does seem to be very, very safe to have the vaccine. Most people do get a sore arm. Quite a lot of people feel a bit feverish for a day or so. I have to say that I didn't have any reaction to it. Well, I had a sore arm, but nothing else. But people do vary a bit. And I do know people who felt poorly for a day or so, but only for a day or so. And otherwise, it does seem to be a very safe vaccine.
So out of your 3,000 odd who you vaccinated, you've had no real adverse reactions?
No, I'm not aware of anyone who's come back and said, or who's need any medical attention for their reaction to the vaccine.
So you're now at tier 2, if I understand the tiering system. Is that right? You're on the over 80s. When do you think you're going to get down to?
We're down to group 4 now. We're down to group 4. So we've just started this week. We started. So group 4 is over 70s and clinically extremely vulnerable. And we decided, we've only just started that group, and we've started with the clinically extremely vulnerable. So we've not been able to do all of those patients, but we're bringing some of them. Unfortunately, we don't have it. Sorry.
Finish off.
We don't have any more vaccine coming this week, so we've only just made a little inroad into that.
So it's Tuesday, and you've got no more vaccine till when?
Probably Friday week. We know we're not getting. We have previously been getting deliveries on a Friday, And we've been told we won't get any this week. We hope we'll get some the following week.
This is on Friday the 5th is your next vaccination delivery, correct?
Yeah, and because it arrives on a Friday and we don't know what time, it means we either have a weekend clinic or we use it on the Monday. If it's the Oxford AstraZeneca vaccine that we've been getting recently, which only comes, we're only getting about between 300 or 400 doses at a time, then we'll probably do that on a Monday afternoon. If it's the Pfizer again, which it could be, then you have to use it all really quickly. So that will probably mean a weekend clinic. So there's usually quite a lot of fairly intense activity that goes on as soon as we hear that we're getting the vaccine. We usually get about a week's notice.
Is there a black market in vaccines? Are GPs bidding against each other for supplies of vaccines, or is it organised?
No, I think it is organised. Some of us would quite like to know exactly how the algorithm works to sort out who gets it, but I don't think it's not a question of bidding. Interestingly, you talk about black market. We've seriously been advised we have to remove all the labels from the vaccine vials before we throw them in the sharp bin and they get disposed of, just in case somebody might steal them and fill them with something else and pretend it was vaccine.
What's your position on? Sorry, finish off.
I'm just saying it's valuable stuff. It's gold dust.
What's your position on one jab or two?
Really, really difficult question. So on the 30th of December, there was an instruction that we should not give a second dose of Pfizer vaccine at the 3-week interval that was originally planned, but delay it until 12 weeks. I thought that was a difficult decision, particularly for the patients that we had already started a course of treatment. So some people had already had one vaccine and had been told you must come back in 3 weeks, you won't be properly vaccinated until you've come back. And quite a few people had agreed to have this particular vaccine on the basis of 2 doses 3 weeks apart. And I felt quite strongly that we were wrong, we would be wrong to cancel those second doses, which we'd do in a few days' time. Partly it would just be incredibly hard work, ringing up everybody, explaining what was happening, rebooking them for sometime in March, and then booking another 1,170 people to come and take the doses that that group wouldn't be taking. But also I felt it more fundamentally, it was something about consent and agreement and what people had signed up to. Going forward, I think it's a much more difficult question. Tim Harford of this parish has written quite convincingly about comparing 1 dose of vaccine to 1 headlight on a car and 2 doses to 2 headlights, and maybe you're very much better off with every car driving with 1 headlight rather than every other car driving with no headlights. Mm-hmm. I think there are so many unknowns in this, and one of the big questions is how good the immunity after 1 dose is, particularly in the very elderly, because we know they tend to have a less good immune response than younger people. And secondly, how long that immunity after 1 dose lasts. And these are just big unknowns, and we have to extrapolate from data on other immunisations, and there's a lot of guesswork involved. I tend to think now that the experts on the Joint Committee for Vaccinations and Immunisations, I mean, they're good people of good intent, and they know a lot more about it than me. So it's probably the right thing to do to spread the vaccine more widely. So if you're getting 60% coverage with double the number of people rather than 95% coverage for half that number, that's probably a good thing. But as I say, there are an enormous number of unknowns in it, and there's lots of people feeling really quite cautious. There's a particular other issue in that about whether people who are really frontline, so the people working in our hospitals, should be getting the 2 doses, and some of them are the people who've not got their second dose of the Pfizer.
So, which side? Finish off.
Yeah, I was going to say it's less of a problem with the vaccine we've been using recently, which is the Oxford AstraZeneca vaccine, because that was tested with a 12-week interval. So we're using it as tested, and that's really not. It isn't a problem at all to be having a 12-week gap with that one. It's really just the Pfizer vaccine.
So, what's your medical view? Which side do you come down on in this debate?
I have to say I don't know. I still think that we did the right thing in giving our second doses locally to our over 80s. And I think the thing that I would really want to know to make that decision is what the supply chain's looking like. How much vaccine have we got? Because that's what it depends on, really. If we had enough vaccine, we would do everybody at 3-week intervals. That would be not a problem at all. It's all about vaccine supply. I think probably with limited supply, the current decision to delay is probably the right one, but I don't know.
There's discussion about how the efficacy of the vaccines. The Germans yesterday, you may have seen it, said the AstraZeneca one was only worked 8% of people over 65, I think. What did you think of that?
Yeah, I wasn't quite sure what data that was based on. And as far as I was aware, that vaccine had been tested on quite a lot of older people who had produced a very good antibody response to it. So I would be interested to see the actual data that publication was based on. I hope it's not made people feel too anxious before we actually know what's going on.
It's made some older Germans anxious, very probably. But there's going to be a vaccine nationalism war, isn't there? I mean, the Europeans are saying don't export Pfizer to the UK, and sooner or later we will say don't export Astra to Europe. Is there any sense in that?
One commentary I heard was that actually that was one of the reasons that the Germans weren't getting the Oxford one, so then they were cross about it. I really don't know. I find the nationalism that's come into this very bizarre and disturbing, actually. I mean, in the long run, we'll only all be protected when everyone is protected across the world. And the kind of printing, I mean, I saw some tweets where the number of people vaccinated was kind of overlaid over the Union Jack, as if somehow this was a fantastic national or UK-wide British achievement that we'd vaccinated, leaving aside the fact that actually we have done really appallingly in this pandemic. We now have more people per head of population, more deaths than any other country in the world, and we have done so badly from so many things. And I actually think that international comparisons probably not doing ourselves any favours to keep harping on about international comparisons.
You've segued very nicely into your view on how the government's done. You may or may not know that I've edited 3 books and just about to publish a 4th one about the pandemic, about what's gone wrong. What has gone wrong? Why are we world beaten?
Oh, I mean, I don't know what the reasons behind it were, but there was a complete failure to take this thing seriously. We could see that it was coming. It was coming from China, then it was in Iran, and then it was in Italy. And those of us in the medical profession were getting really quite anxious. You know, it's coming. We need to be prepared. We need to do something about this. And yet there was a real lack of decisiveness. People just wouldn't get on and do anything about it, which would have meant shutting down mass events and having a lockdown very much earlier than we did. There's a kind of bizarre optimism that has characterised this government over and over and over again, that we will be just fine if we open up everything all at once in July, that if we send everyone into restaurants to eat and help the economy, everything it'll be fine, it won't spread the virus, when it was very clear that would spread the virus. So there was a real failure to listen to experts. I have to say there were probably some other people who thought of themselves as experts who said the things that the government wanted to hear and were preferentially listened to. But it has been a disaster. And I think one of the reasons for the disaster was our state of unpreparedness, because the kind of pandemic planning that had been done and was kept going for quite a long time had been stood down, and public health services have really been decimated in over the years of austerity, and the PPE stockpiles had been run down. So everything that might have been there to help us get off the starting blocks had been got rid of or ignored. I think there's also the other thing that, for me, I think underlies our failure is actually asking the wrong people to do the jobs we needed to do to get out of this pandemic. Those things like the test, track and trace, particularly handing money to people who have no experience in doing this, to set up entirely new systems when things needed to be done in a hurry. If you need to do something in a hurry, you need to ask the people who know how to do it, which in that case were public health experts, and they were completely sidelined. So that's one of the many reasons we've done so badly. There's a little bit also of British exceptionalism. If we had been prepared to look east and look to the countries that have really done this well, so Korea, for example, South Korea spent, I think, 0.5% of its health budget on track and trace, and has done it really, really well and managed to contain the pandemic. We've spent 10% of our health budget on the same function, and it doesn't work at all.
We spent 22 billion on track and trace.
Well, it's a question. I think it's been allocated 22 billion. I think it's only spent 12 so far. That's the latest figures I've seen. But there's a nice illustration, because people can't really think about billions. If you think about 12 billion, that is £10,000 a day, every day since the end of the Bronze Age. It's a lot of money.
And has track and trace worked?
No, it hasn't at all. And there's lots of reasons for that. Partly the wrong people doing it without the right expertise, partly because they've tried to do it nationally when it really is a local thing. You need local knowledge, you need local input. You probably do need to involve GPs and local public health to make it work. I think the other very fundamental point is that it's really difficult to isolate if you are the only breadwinner in the family. If you're the person on whom everybody else depends and you won't get paid unless you turn up for your shift, then it must be really, really difficult to get a test and isolate if there's not money coming in. And we know, although there has been some support earmarked to help people isolate, we hear that the majority of claimants for that support are not awarded it. So I think, I come from so much privilege, it's quite difficult to put myself in that position, but I can totally see that if you don't get any money and you can't feed your kids if you don't go to work, why would you isolate?
Have they learned from their mistakes in the last year? Because we're coming up to the grim anniversary, aren't we, at the beginning of March? Do you feel that Matt Hancock and Boris have learned from their many mistakes?
It's not clear. I gather the borders might be finally being closed about a year after, which is quite quite spectacular in terms of a delay between the horse bolting and shutting the stable door. And there are some things that are just so spectacularly wrong. For example, after Christmas, there were lots and lots of people saying, just please, can we not get the schools back because we know there's a huge spike in infections. I mean, leave aside the daftness of saving Christmas. And actually what they did was send teachers and pupils back to school for a single day before they finally caved into pressure and decided that school would have to work from home. And if you were trying to design a system for spreading the maximum virus, that's probably what you'd do. So I'm not really seeing any evidence of learning, unfortunately.
But you mentioned exceptionalism, but Boris seems to be stuck between, a libertarian rock and a hard Tory place, doesn't he? I mean, he hasn't quite ever faced up to the fact that you have to be rather hard in this pandemic.
I think you could be quite right there. One hears that he's always been, he wants to please the person he's with now, so he just says yes. And actually, if you contrast that with the maturity and the decisiveness of leaders like Jacinda Ardern or Angela Merkel, I know things haven't been brilliant in Germany either, but they've been hugely better than they have been here, because you've had people who say, look, I know you don't like it, but actually, if we look at all the facts, this is what we've got to do. And there's also something that I find quite difficult to fathom, because anyone thinking just for a few minutes can see that if you have a really hard lockdown and close down your economy, that's really bad for your economy. On the other hand, if you get rid of the virus by doing that, you can then go back to normal. Whereas if you don't do that and the virus stays and stays and stays, and you carry on with partial lockdowns for, as it has been, nearly a whole year now, then your economy is so much worse affected. And that seems like so likely, even if you just think about it from first principles. It's very difficult to see why the cabinet couldn't see that.
Dead people can't work, can they? I mean, if Boris were to invite you to say, Helen, come give me a 5-point plan, come to Downing Street tomorrow, what would you say he needs to do now?
Just going back to dead people can't work, also people with long COVID can't work. And I think that's something that's been missed out of the conversation quite a lot, is that a lot of younger people, 1 in 10 by some estimates, have long-lasting symptoms from having a coronavirus infection. And these are people who were previously really productive in the workplace, young, fit people, and then they can't work. And I think we haven't even started to count the impact of that. What would I do now if I had to talk to Johnson? I would have to rein in my language and sit on my hands, I think, because I've been quite angry. I don't know whether you picked that up.
I have.
And I would talk about putting the things that should be in public hands back in public hands, in terms of the test and trace and in terms of the vaccination campaign. I would talk about the need for actually a very firm, we really do need a very strict lockdown until we are on top of this virus, until spread is prevented. And we need to pursue a policy of elimination of the infection. You get infections down to a really low level, and then you have a super efficient test and trace and isolate and supported isolation strategy, so that every time cases do arise, you can contain that cluster. Think of it as a fire. The fire is raging out of control at the moment. If we can get that fire under control, then we need to then have really good surveillance, so that every time a little blaze starts, you are on it and prevent it spreading any further. And that's that's the only way we're going to get our normal life back and get our economy back. And we'll also rescue our hospitals at that point as well.
Give us a timescale for lockdown and out of lockdown. Any idea?
I just don't know. I hope that by the beginning of the summer, we should be getting to a very much better place. We know that when things can happen outdoors, that also helps to reduce spread. But I think there are an enormous number of unknowns, and unfortunately one of those is about mutations and escape from the control of the virus. Over the vaccine, there's a lot of unknowns in that. And really, I suppose, in terms of mutations, we've got to get as many people vaccinated as quickly as possible, because the fewer people that are infected, the less chance there are for new mutations to arise.
But if you're on Sage, when would you recommend easing lockdown? Because Boris is under a lot of pressure on this.
I would probably say we can ease lockdown when cases get below a certain level. I probably wouldn't put a time on it. I would say this is where we need to be when we have our track and trace working really, really well, and when we've got cases at below, I don't know, at single figures per 100,000. I don't actually know which numbers it should be. You need to ask a public health person rather than me. But I think it has to be about numbers of cases so that it can be controlled, rather than a date, because there's just too much uncertainty with dates.
So if you're planning any mass gatherings in Jericho or elsewhere, you wouldn't plan them before midsummer, late summer?
I wouldn't, no. I wouldn't. Sadly, I really want to see. I have to say, one of the nicest things about running the vaccination clinic was to have my waiting room full again of people. It was lovely to see so many people all in one place. They haven't for ages. I mean, they were all 2 meters apart and they weren't there for very long, but it was still lovely to see so many people. But yeah, I don't think I'd like to see lots of people outside that sort of situation for quite a while yet.
You did wonders for the local taxi trade. I mean, they were queuing up outside. What's the relationship between your practice and the health centre and Jericho? How do you view that?
I mean, it's lovely to be a local practice. I think people read lots in the press about the demise of old-fashioned general practice, but I like to think that we are an old-fashioned general practice. We serve our community and we visit in our community. And I had one of the best afternoons ever recently out on my bicycle, visiting people over 80 in the local area to give them their COVID vaccines at home, people who couldn't come into surgery. So, you know, I like to keep things local.
So do you employ locums for home visits, or do you do all that yourselves?
We haven't employed any locums for it yet. No, we hope to do that all ourselves. And I think it's easier for the locums, if we needed them, to come and work in our surgery and do something a bit more structured. I think it's for patients particularly, they quite like to see a face they already know.
Now, more general health questions. What are the sort of major things that people come to you about in Jericho? What are the major diseases?
I'm not sure I can generalise, actually. People come with everything. People come because they've got symptoms that they're worried might be a sign of something serious, like cancer. They're coughing or they're bleeding, or they come with they can't hear properly because they've got wax in their ears. They come because they're feeling low and anxious and can't concentrate and can't sleep. And there's an awful lot of that around at the moment. I would say I have pretty much every symptom comes, and sometimes I can put those symptoms into a neat box and give a diagnosis and give a specific treatment, and sometimes it's harder. But we have a fabulous hospital up the road that we can refer to when I'm out of my depth. They're struggling a bit at the moment. But yeah, I think I suppose that one of the things that we don't have so much of it in this side of Oxford, but is certainly here in the city, is the diseases of poverty, because Jericho is, on the whole, quite affluent, although there are exceptions. But otherwise, we get pretty much everything.
What about mental health? Have you noticed any deterioration or any more people referring to that during the pandemic? What sort of things are presenting themselves to you?
There's quite a lot more anxiety, and particularly in all age groups, but certainly our older people with anxiety. I think isolation has been really, really bad for people's mental health, and not everybody is able to use technology to keep in touch with people. Not everyone goes online, and I think people have got very sad and very worried about the future. And I mean, there are things that make people very anxious. There's been a lot of coverage on the television and a lot of footage of intensive care units, and that's really, really scary. And I've had patients actually not wanting to go to hospital, in fact, refusing to go to hospital because they're worried that that's what's going to happen to them if they go. So yeah, lots of anxiety.
On the intensive care units, there have been some cracking television pieces on ICU, some by Clive Murray last week and one by Sky yesterday. Now, the Daily Telegraph is sort of running a campaign to say, why are we seeing this? We don't want to see this. I mean, there's a column by Janet Daly today about frightening people. Should we allow cameras into ICUs?
It's a really interesting question. There's a downside to frightening people, which is that they may refuse to go to hospital because they believe that is what will happen to them inevitably. On the other hand, there are still a number of people who are not taking this seriously, who say, COVID it's all hoax, it's just a sort of flu, it's not really a big deal. And I am undecided about whether the scary television is a good idea or not. I think it can certainly be overdone.
If a COVID denier presents themselves to you in your surgery, what would your argument be with them?
Oh, I'm not even sure I've got the the energy to argue, because it's very clear that many people have died. We've had 100,000 excess deaths this week sometime, and something is killing these people. So if they want to disbelieve that, then I'm not sure that any reasons I can give them are going to persuade them, because they've kind of already shown themselves to be, I think, impervious to argument.
Well, they lost a bit of support with the demise of Donald Trump, of course, who was the COVID denier in chief. We're getting towards the end. The final couple of questions. The end of the tunnel. Is there light at the end of the tunnel?
I think there definitely is light at the end of the tunnel, because I have great faith that these vaccines will work and we'll get out of here. But it's still a little way off. And I guess there's a worry that people will think that, okay, we're nearly there. I can stop keeping my distance. I can stop wearing a mask. It doesn't matter if I meet up with people. And we have to remember that even at their very best, vaccines will only be 95% effective, which probably means that 1 in 20 people will still be at risk of getting ill, which means we are dependent on each other. We're dependent on our neighbours and our friends and our colleagues to do the right thing, and keep opening the windows, keep wearing the masks, keep keeping our space until we get down to the level where we can stamp out every spark.
On a very positive note, are you proud to be a member of the medical and scientific community in Oxford at this particular time?
Yes, I mean, I'm not quite sure whether it's fair for me to be proud of the scientists in Oxford, but I mean, it's fabulous that they've done so well and helped us so much. And I'm very grateful to be a doctor at this point, because it's good to be able to feel you're doing something useful. I think everybody wants to be useful. And particularly when it comes to vaccinations, there's huge satisfaction. And on a personal level, I've had, for this year, I've been able to go to work and talk to colleagues and continue doing something that I enjoy doing. And that's a huge privilege.
And one last message for the people of Jericho in terms of health, wealth, and so on for the next period.
Keep looking after yourself. Try and stay cheerful. Do please get in touch if you're not well, because we're still doing normal things. Normal illnesses still happen, and people need treating for all the other things apart from COVID. We're quite safe in our practice, so if we invite you to come and see us, please come.
Helen, thank you very much. Everything people said about you is right. We'll just end with a couple of commercials for things coming up. Next week, Professor Gary Browning, a Jericho resident, will be talking about Bob Dylan at 80, with some music and maybe even a local musician playing Bob Dylan. Then in 2 weeks' time, on the 10th of February, the issue that unites and divides us all about the low traffic neighbourhood. Where is it at? And the television host John Stapleton would share that. Now, what we'd like is your point of view on that. So if you've got a point of view on that you'd like to make, contact me. My email address is all over the place. It's johnmayer100 at hotmail.com, and we'll put you on. And finally, I've now edited my 4th book, which is going to print, called Pandemic, A Year of Mistakes. That'll be available in Amazon in about a week or two's time. But thank you very much, and stay safe. What's the phrase? Protect the NHS. I've forgotten which slogan Boris is pushing at the moment. But is it hands, trace, and face? I can't remember. But
don't forget the fresh air.
And fresh air. Always go out for a walk, at least one walk a day. Thank you very much, Helen, and all the best. Cheerio.
You.